Well, hi everyone. Daniel Williams here, senior editor at MGMA, host of the MGMA Podcast Network. And I'm happy to bring back to the show Dr. Alex Ding. He is with Humana there. He is Associate VP for Physician Strategy and Medical Affairs at Humana. We've had Dr. Ding on the show a couple of times already, and we are glad to welcome him back and talk about some research that Humana and MGMA have partnered on. Dr. Ding, welcome back to the show.
Well, thank you so much for having me back on the podcast, Daniel. I'm really excited to discuss the MGMA-Humana AI Adoption Report today. It is a collaborative effort that highlights the current state and potential future of AI in healthcare. At Humana, we've invested in this white paper because we recognize the strong interest from provider organizations in using AI as a tool to reduce clinician burdens, enhance efficiency, and ultimately improving patient outcomes. This partnership with the MGMA really reflects our shared commitment to supporting providers in their journey toward value-based care by offering insights, tools, and innovative solutions. And I'm really looking forward to diving into the findings and discussing what we learned about how providers are approaching AI today.
Yeah, that really is exciting, and it's almost become commonplace to talk about AI in all facets of healthcare and I guess our lives at this point. When we think about it from a healthcare perspective, where are we with AI right now, as far as from where you're standing and the work that you and your team are doing with AI? Where do you see healthcare and AI in this stage of the life cycle, so to speak?
Yeah, I think maybe what would be helpful is to just jump right in to talk a little bit more about the context in which we've
Okay.
thought about this report that we've jointly produced. So this was a survey of MGMA members that are medical groups, clinics, health systems. It was conducted in the summer of this year on their usage and their perceptions about AI and healthcare in their organizations. So in that survey, we got about 250 groups and systems that responded, with most of the respondents being administrators, non-clinical leadership. And we did note that there was a wide range of specialties that we covered. There was great representation from various different corners across the country and different types of practice models and places, including suburban, urban, and rural areas. But I think, to get back to your question, I think the bottom line that we've taken away from all of this is that AI adoption, everyone's talking about it, and it's growing. It's also accelerating, but at the same time, it's still in its relatively early stages for a lot of these organizations. The report showed that about a third of practices have already implemented AI tools that have been primarily focused on thinking about how do you address operational efficiencies. But a lot of groups are still really learning into use cases and opportunities and really understanding what all of this talk about AI is and how do you translate that into business value. So I think, interestingly, for practices that are in value-based care, one of the things we kind of a big takeaway from the report is that we saw overall greater adoption of AI tools in multiple different areas, including ambient AI, clinical documentation, but also clinical and diagnostic tools, patient engagement, predictive analytics, and revenue cycle management. And I think that is consistent with what we've seen in other instances of value-based care practices being more likely to invest in practice tools, including higher adoption rates that we've seen in telemedicine, remote patient monitoring, just as some examples. And I think this is also consistent with what we've seen in other instances of value-based care creating kind of this natural fit for AI, because the model emphasizes outcomes, coordination, proactive interventions, all of which AI can lower the effort that's needed to do this work. And so the area that we saw the highest kind of difference in AI use between value-based care and fee-for-service models was in predictive analytics, really proving out that value-based care, with its different incentives, with its different payment model, really does incentivize management of populations and panels of patients. And the use of predictive AI models can really improve that efficiency in managing these complex patient populations.
Okay. One of the things that stood out in the study, and really when we're talking about AI, how do we improve process efficiency and alleviating some of those administrative burdens? We talk about pajama time for physicians, or it might just be just the sheer overwork for healthcare professionals. So, from your research, how has AI proven effective in addressing these areas within healthcare practices? And what else might you want to share about that, where it really is giving some help, some help, because we know we have staffing shortages in a lot of places. So where is AI playing a role?
Yeah, I think, given that acceleration of AI adoption, still a lot of places are building up that understanding of AI, and there's um, really relatively nascent experience so far. And so a lot of places are still trying to figure out what is the right way in which to use AI. And one of the areas that we've heard a lot about in that survey is in the form of efficiency of documentation. So in the form of ambient AI,
Okay.
transcription, kind of think it as a virtual scribe, if you will, with over 2/3 of those organizations who have adopted AI citing this as the use case in their organization. And this touches on the question that you just mentioned about kind of clinician burnout. And the reason I like
Mhm.
this use case so much is because I still do think that clinician burnout remains about half, if not more, of clinicians that are surveyed across this country. And one of the top reasons that are cited for burnout are administrative and documentation requirements. And so this is, to me, a low risk way to get into AI, but also a great way to get clinician buy-in because you're doing it in a way that supports them. It's not threatening. And you're not saying this AI is going to replace you. It's actually going to help you do your job. And not to mention, you're gaining operational efficiencies as well. And so um, one of the other things the survey dug into is looking at the various different stakeholders that you've got to bring in for AI adoptions. And clinicians were really near the top of that list with motivating factors for them being process efficiency, but also reducing clinician and staff burdens, improving quality and accuracy. And it would seem to me that ambient AI really has that potential to address a number of these challenges.
Okay. Um, so when we talk about AI, there are a lot of tools out there, but then perhaps there's training to efficiently and effectively use it. So there's the training side, just can I use the tools? But then there's also the ethical implications of the use of these AI tools. So how are we getting the training? What does that look like right now? And how do we bring that about in an ethical and HIPAA compliant way?
Yeah, great question. And definitely one of the other areas that the survey gets into is really thinking about governance structures, guardrails, ethics. And according to the survey, one of the biggest pieces that stood out is really that education and training is probably the primary barrier to AI adoption. So I think organizations really should be prioritizing education of their workforce on AI tools and also to be ensuring that resources are available for both technical guidance, but also ethical guidance, as you've alluded to as well. And so, I think one of the things you often hear about in talking to people that are getting into AI is, how do you trust the system?
Yeah.
How do you learn more about it such that you can build and establish trust with the system? And I think the education and component and training component is a significant part of that. Some of the other barriers we heard about to implementation include the cost, with some concerns raised of kind of a new line of digital divide between the AI have and have nots. And I think that, along with the lack of capacity and the resources for successful deployment and implementation. But on the topic of governance, I think that is equally important. But we heard, probably because of people's relatively nascent experience with AI, that nearly 3/4 of organizations really don't have any formal governance structures in place at all. But I do think it is a crucial element because as you learn more about AI, you learn that there's shortcomings, there's limitations that the users and the adopters really do need to understand. And so we heard that data privacy and ethical guidelines are top concerns and considerations for these organizations. Really need to wrap their arms around this to help manage that risk and ensure that AI aligns with with their missions.
Right. So let's talk about buy-in and buy-in from the top. So you got to have that leadership of the organization want to have this to have the buy-in from it. They're looking at the return on investment. So what are some of those metrics that they're paying attention to see if some of these AI tools make sense in their organizations?
Yeah, I mean that only makes sense. And what we had heard is that almost three-quarters of those that we surveyed noted that a clear demonstration of ROI is really a crucial component for them to get buy-in and the resource allocation behind AI adoption in their organization. What we heard is that operational efficiency is really probably that top ROI metric
Mhm.
that is cited in the report. Streamlined workflows directly reduce time and costs that are spent on administrative tasks and getting more productivity in their organization without necessarily everyone having to work harder to achieve that. And then when we talk about ROI in a value-based care setting, however, I think that is with somewhat different framing. As you know, in value-based care, it's less about churning through volume where productivity is so critical. And so some of the AI tools in supporting value-based care practices include remote patient monitoring, care coordination, care management, addressing gaps in care, and really other ways to support the quality of care and better chronic care management, with an ROI there really being based on improved quality scores or reductions in readmissions is just one example. And nearly half of the respondents noted that improved patient outcomes is particularly a compelling non-financial metric that really increases that buy-in from clinicians and clinical leaders.
Okay. Now, two of the things that stood out, you've talked a lot about operational efficiency that came out from the report. Patient outcomes is also a key ingredient here that's really being looked at through AI tools. Do you have any case studies, whether it's a case study or anecdotal information from practices that have been utilizing some of these tools and how they've affected either patient care or that operational workflow?
Yeah, you mentioned a couple of important use cases and opportunities for AI. And I think one of the fun things, but perhaps also one of the daunting things about AI is that the world in which it can be applied is really endless and the use cases can be infinite. And as while that is exciting, can also be quite overwhelming to think about. And so
Hmm.
one of the things that the study provides is a couple of examples of these real use cases to really put some color on what these opportunities are. So, for example, in the report, there's a health system that is using AI to power virtual agents that are assisting to remotely monitor patients with diabetes. And we're finding that that is boosting care touch points, boosting quality, and it's been linked with cost savings as well. And so a number of the use cases that are included in the white paper are focused on those technology products or those platforms that value-based care practices use as well. And when you infuse it with an additional layer of AI, that these additional opportunities or functionalities and efficiencies can be captured through this AI enablement.
Okay. Got time for a couple of more questions. I know that you're busy and you've got a lot of things on your plate today, so I really want to touch base with you on two more things. The first one is you've mentioned predictive analytics. I haven't brought up revenue cycle management yet. I would love to hear what some of the potential opportunities are in those domains. What can we expect to see in the future with RCM and those predictive analytics when we're talking about AI tools?
Yeah, I think in RCM there are a number of different opportunities. We've seen various different use cases so far in which AI can automate coding and claims processes, reducing denials, ensuring that payments align with delivered care. With predictive analytics, we've seen great potential for population health management, really enabling more proactive care management for identifying who are those that have greater needs and providing them additional support or touch points. And I think these tools are going to continue to evolve and get better and really prove themselves in terms of value. But I still think that the integration of these tools into the existing platforms, into the existing electronic health record is really critical to their overall adoption, because that seamless workflow really is what's going to help it take off. But I think it also raises kind of an overall bigger question of what we heard from our organizations, and how do they think about what defines success with AI? And of those that have implemented these AI solutions, more than 70% of them are already saying that they're seeing some, if not more than some, success in the effectiveness of those tools. And at the top of those measures of what they consider to be effective or successful, we saw, as you mentioned, operational efficiency at the top, with more than 90% of those considering that to be really the top most important measure of success. But then we also heard about really the importance of thinking about and accounting for staff satisfaction, cost savings, patient outcomes, and patient satisfaction in the adoption of these new tools.
Okay. Final question, and I'm glad you just brought it up. You mentioned the term population health. So let's take a look into high risk and underserved populations, and what kind of role can we see AI providing in those population health areas?
Yeah, I think one of the things that AI is really, really good at, and I think one of the things we should figure out is what are the things that AI is good at, and we should perhaps divert more of the work to AI there. What are the things that humans are really good at? There's probably two different skill sets that AI has and humans have, that there is some overlap and there's probably some distinction as well. And so I think AI solutions, or AI as a technology in particular, is really great at pulling needles out of haystacks, really identifying what is the signal from the noise in huge sums of data. So think population health data. And so it can pull those needles from a haystack and identify gaps in care, what are those high risk needs, and other really important data points that would take a person or an individual a lot of time sifting through. And so I think that's really one huge opportunity of AI in population health. I think one of the things we're also hearing about is the potential to use AI solutions for engagement, for patient engagement. And I at my core, really do believe, though, that healthcare is a people business. It's a high-touch people business that relies on relationships, and really that therapeutic nature of those relationships as the basis for that patient-doctor relationship. And I think here that's where humans excel, in that relationship building and building trust. And so I think rather than using AI and technology to addressing those relationships directly, I think it's more about using the technology to offload, what I'll call the boring stuff, the administrative stuff, the drudgery of practice,
Yeah.
such that you can really free up time for your clinical staff to do what they went into healthcare for, which is spending time with patients, building relationships with patients, hopefully bringing back that joy of human interaction, which is where I really think this opportunity is. And I think, there's an opportunity to, as a result, increase and build that workforce capacity by offloading a lot of this administrative stuff to AI, such that you can really focus on the patient and increase access to care as well.
Yeah. Well, Dr. Ding, I want to thank you for joining us again on the MGMA podcast. It's just such a joy to have you on here, and for you sharing these valuable insights on AI's evolving role in healthcare and sharing results from this recent report. So thank you so much for that.
Thank you, Daniel. Thank you again for having me. It's been a pleasure to partner with you at the MGMA on this joint report, and to have the opportunity to share these insights with your audience. Thank you.
Yeah, you are very welcome. And everybody, that is going to do it for this episode. I did want to say again, it's the MGMA-Humana AI Adoption Report. I'm going to put that in the episode show notes. We'll also provide a link to it on mgma.com. So we'll be where you can easily access it, go over the report yourself. So be on the lookout for that. So until then, thank y'all all for being MGMA podcast listeners.